You're listening to The Money Hour with your host, Tina Mitchell, on Alternative Talk 1150 AM. Now, back to the show with local mortgage expert, Tina Mitchell.
You are listening to The Money Hour at 1150 AM KKNW, the Saturday, November 19th show. You can also listen to my show podcast, Facebook premiere. You can catch my show on my show YouTube channel. I'm your host and local mortgage expert, Tina Mitchell. I bring into studio each week the best of the best experts in our local market on everything regarding your money. Now in studio, I have Dexter Borbe of Interim HealthCare of Bellevue, in-home care right here on 1150 AM KKNW. Dexter, great to have you.
Well, thank you for having me here, Tina. It's a pleasure.
Yeah, very excited to have a conversation. And what a great combination to have you and Aaron together on this show, and really just a great service that you're providing to our seniors and our community. So very exciting. So Dexter, what does Interim HealthCare do?
Yes, so we do what's called in-home care, which is caregiver support for people who live in their homes. Our caregivers provide, I bucket it into three areas called personal care, which is bathing, dressing, grooming, continence support, toileting, transfers, ambulation support. We also provide homemaker services, right? So because the same people who suffer from these problems will need help with meal preparation, with laundry, with light housekeeping, with getting errands done, with groceries, trips to the doctor. And they also provide companionship because people need to have, some people who may have trouble with some of their primary functions might not be going out to do what the things that they used to love, might not be going out for walks, might not be going out to the library as much as they used to, and our caregivers help them do that.
Oh, that's wonderful. And what a great shout out, because that is one of the core things that you need. It may not be, people might not think about it as much, but it's definitely a core of companionship of what you need to be as healthy as you can as you're getting into those next years. So what does in-home care look like, Dexter?
So in-home care basically is having a caregiver come support you or your loved one at your home. Our caregivers are all licensed by the Department of Health, either certified home care aides or certified nursing assistants. We, of course, vet them, drug screens, criminal background checks. They're all our employees, so they're licensed, bonded, and insured. Mm-hmm. And we start with an assessment. We assess the person's needs, what their needs are for in-home care, what areas do they have difficulty in, what areas they need support in, and we create a care plan. On the first day of care, we do what's called a meet and greet, where somebody from the office will introduce the family to the caregiver and the caregiver to the family. As you might imagine, families might have a little wariness about having somebody new in their home. And to be honest, the caregivers are a little wary about what kind of home they're walking into as well.
That makes sense.
Yes. So we do that. We go over the care plan together, so everyone's on the same page. And we also make adjustments when we learn something that's different from when they discharge at the hospital, something's changed. We make adjustments to the care plan. We typically call at the end of the first day to ask the family how did the shift go with the caregiver, right? We believe if the first shift goes well, the rest of the shifts will go well. We also call the caregiver to ask how it went and if they observed anything. So because we have to provide services in other people's homes, we don't control the environment in which the services are provided. So we try to have processes and procedures that allow us to effectively deliver the effective care for people.
Yeah, you have to equally support your clients and your team that supports those clients. So I love how you're making sure that everybody is happy with the setup. So how is it different than a nursing home?
Yes, I mean, I think the term nursing home, I think now is it's been broken up. I think what we used to call the nursing home is now more specialized, right? There's different types. You have independent living, which is mostly independent people who may get support in terms of, somebody comes to change your linens every so often, then there's a kitchen downstairs that makes your meals. There's assisted living, and then there's memory care, right? Assisted living is where they have. So the difference is that our in-home care service provides the care for the client where they are. right? So basically, where they are can be in their own private home. We also provide services in senior housing. We can provide home care. Our caregivers can go into independent living communities so that the residents can get over maybe what might be a temporary condition, such as recovering from surgery, right? Or a chronic condition, but they need occasional support for, like, being able to go to the doctor, twice a week, or go to chemotherapy, right? And having a caregiver who can help assist them, dress them up, bathe them, get them going. And in assisted living, we sometimes perform what's called a supplemental 72-hour observation. So sometimes when people come home from the hospital, they may need to be observed for 72 hours, right? And as great as our assisted living communities are, they don't always have the resources to have a caregiver just sit one-on-one with one resident, because they have the staff there have to serve all the residents.
Absolutely.
So we can come in to supplement their staff and provide that kind of temporary care, additional care.
Okay, that is wonderful. So let's talk about insurance, because it's not an inexpensive. I mean, you have to pay for this service, and so how does insurance come in to assist, or does it?
Yes, no, that's a very good point. I think one of the things we often get asked is, does insurance cover it? And regular health insurance does not.
Yeah.
Right. What covers this is long-term care insurance. And after starting in this industry, I now recommend to all my friends, go find a long-term care insurance agent and get yourself a policy, because we're all getting older.
Yeah.
We're all getting older. We all will need help as we age, and we all will live longer. So we want to be healthy, and we want to be safe as long as possible. As Aaron pointed out, majority of older adults prefer to stay in their own home, right? Because that's where their memories are. That's where their children grew up. That's where they made their accomplishments. So long-term care insurance helps cover it. Medicaid also covers it, as well as Veterans Administration benefits, but they're offered to a limited extent. Right? It's not because when you're talking about the state does not have infinite resources, right? So they have to prioritize. They have to also manage and get care for people with the resources they have.
Yeah. Go ahead.
Oh, go ahead.
No, go ahead, Dexter.
So I would highly recommend two things. One is, when you make your long-term plans, financial plans, I run into children of clients who always tell us, oh, I need to make sure I talk to my financial advisor for when I'm going to be there in the future, and to make sure I'm planning for that. And then, look into long-term care insurance, because I think that the demand will just grow. There is a book, my nerd side is coming out. There's a book entitled Who Will Care for Us? It's written by an economist. He was looking at the long-term care industry and noting the big bifurcation in between supply and demand. The demand for in-home care is increasing very rapidly. 50% of it in the United States is provided by family members, right, in an unpaid fashion. But the supply of caregivers is not growing at the same pace.
Yeah.
So if anything, to your point on supply and demand earlier in the show, things that are in short supply but in high demand tend to get more expensive. So get a long-term care insurance plan. I would recommend it.
Yeah, and great, best advice, because my mother-in-law, I had long-term care insurance, and thank goodness. And she started using it just when she fell and hurt her wrist. And I was like, how does she have a caregiver? Nothing's wrong with her. But she did, so she wasn't, and then she stayed in her home as long as we could. She's in memory care now, but a great investment for yourself, and a great investment for your loved ones, because what a position to put them in when you get to that and you're not able to pay for it. So what kind of caregivers are you hiring?
So as I mentioned earlier, as a Medicare, as a Department of Health certified home care agency, right, our caregivers have to be have to follow regulations. So our caregivers are either certified home care aides or certified nursing assistants. We do need to vet them, because a lot of our reputation depends on the experience that the client has with these caregivers in their home.
Yeah.
right? So we want to make sure we are sending people who are qualified, who are trained and capable of providing the care, to your point around expertise. But we also want to make sure that they behave properly, that we do a 50-state criminal background check. We have the full panel drug screen. We require 2 positive references. So most of them that go into the home are already experienced in providing care in some other setting before. They're required to have a first aid CPR card, right? And we do orient, or they're required to have a food worker safety card because they're handling food for clients.
Okay.
So those are some of the paper requirements for the caregiver. But what I really tell people in my office is we look for 3 things that are extremely important in everybody, right? It's integrity, reliability, and compassion at the end of the day, right? Integrity means you'll do the right thing even when no one is looking.
Yeah.
And for many of our caregivers who are working in the home of a vulnerable individual, and some of them live alone, right? Besides the caregivers just themselves, we need to have caregivers who will do the right thing when things happen, right? We try to test for that in different scenarios. Reliability is pretty important because the people that need the care, they need the care.
Absolutely.
It's not like a facility where you have multiple other staff members. Very often it's one-on-one.
Yeah.
Right. So when the caregiver doesn't arrive, the person doesn't get the care. So we need people who will be there when their clients need it. And the third is the most important, is the compassion. Right. The compassion, we define compassion as an active form of caring. Sympathy and empathy are a little passive. It's like, oh, I'm sorry, you're going through that. And it's important. It's a key step. It's a key part of this foundation. Compassion is going the next step and saying, let me help you with your problem. Right? Somebody has had a hip surgery, can't get out from bed. And, then you think about all the scenarios where you can't, where if you were in that situation, you wouldn't be able to do certain things, right? Like going to the bathroom, like making your own meals. It's like very simple things we take for granted every day, but suddenly it's very difficult, right? And we want caregivers who think through that.
Yeah.
At Interim HealthCare, our 4 pillars are mind, body, family, and spirit. And many times when people think about in-home care, they think about the body component. How do I dress this person? How do you bathe them? How do you help them to the bathroom? How do you take care of their, how do you transfer them to a wheelchair? But there's the other parts are equally important. The mind is how engaged are they? Are they having conversation? Are they reading? Are they doing crossword puzzles together? And sometimes these are enjoyable things. Spirit doesn't have to be, it's not really religious, right? Can be, but it doesn't have to be. It's basically their desire, their will, their joy of life, right? We had the client before had 1 week, 1 day of care for each week. But the moment the caregiver arrives, she's on her walker, she has her bag on her shoulder and her lipstick on, and it's ready to go out. Because that 1 day is the day she gets to go out with her caregiver, right? She has difficulty driving otherwise. And family is an extremely important component of caregiving. So we also try to share resources with family, and how to manage diabetes, how to congestive heart failure. We know that our caregivers can't, depending on what the clients ask us for, the caregivers may or may not always be there, and some of the care is also provided by family members. So we try to share resources so that the family is aware of some of the considerations.
Yeah. A lot of skills, absolutely. And a certain personality type that not only is compassionate, but compassionate for seniors, because it's a whole different thing. And so finding those unique people that really have the love and passion to take care of the elderly. And so what a great thing, Dexter, that you go through a substantial process of not just the skills, but also the desire and the passion to be taking care of our elderly. So what type of help are your caregivers providing? You shared a little bit, but.
Yes, I know. I did share a little bit already.
There's a lot.
There's a lot. I think the primary reasons that the caregivers typically are there is to provide what we call personal care. And the industry does regard them, has a term for them, activities of daily living, right? These are bathing, dressing, grooming, toileting, ambulation, transfer, and feeding, right? And these are things that we do every day. Usually when I give a presentation, I ask, how many of you did these things today? And people will say, I did, right? And I'll also ask, what if there was 1 or 2 of them you can't do? What if you can't go to the bathroom? What if you can't dress yourself? right? Your life would be severely affected and different. And that illustrates a little bit about the difference our caregivers make, right? It's everyday things we take for granted because we're able to do it. But the moment you can't, your life is affected. And if you can't do that for a long period of time, your life will be severely affected.
Yeah.
Our caregivers also help with what we call the IADLs, the incidental activities of daily living. So this is what the industry defines as activities that are not as essential as the first set, but quite essential in the long term. And these are your housekeeping, your meal preparation, laundry, transportation, groceries. Financial management is one of them, but our caregivers will not touch anything financial.
Okay.
We instruct our caregivers not to touch anything there are financial advisors for that.
Yes.
Right. And powers of attorney that will help do that. And then, of course, there's the other pieces which are around companionship, around activities, around keeping the person, the clients engaged and active and safe.
Yes.
Right.
Playing canasta, helping them with their puzzles.
Yes. Even just encouraging. We have caregivers that will do the physical therapy along with the client because it's easier to do exercise when somebody's doing it with you.
Yes. Yeah. Well, I've really enjoyed my conversation with you. It's time to wrap up the show, but really quickly, how do they connect with you, Dexter?
Oh, how would they connect with me? They can give our office a call, 425-274-3720. They can visit our website, www.interimhealthcare.com/Bellevue. There's a contact us option there. There's a chat option there for them to reach us.